we're going to talk about the most clinically relevant conditions that affect modern man in this modern era. And I'm going to walk you through it so that you understand the medical management of the condition. In other words, what are the drugs that are used typically to manage a health condition? And last year I gave you a pretty good template as to the physiological basis of diet and some supplements. And what I'm going to show you now this year is how to then look at how the medical management is for a condition. Let's say it's high cholesterol, let's say it's gout, let's say it's Parkinson's disease, let's say it's Alzheimer's disease, let's say it's osteoporosis. What are the medical people doing? And where is the window for you to offer complementary advice around lifestyle modification and good lifestyle medicine, in addition to your chiropractic care, to help the patient get the very best evidence outcome that's available? That's what this course is. So when you start seeing patients and they fill out the intake questionnaire and you see they have other comorbidity issues and you see what medications they're on, it'll be crystal clear where this person is at and what things you have available to you to help improve the outcome for the patient over and above their tennis elbow, their shin splints, their subdeltoid bursa, their chronic headaches. If you want to, give them lifestyle coaching in areas that will enhance their health and wellness in other ways that are looking at more what we would call the general wellness picture. Does that sound enticing to you? So, why would we even bother to study medications in conjunction with nutrition and supplementation? This, after all, is a nutrition course. And it's because many of the patients you see are on drugs, not the kind that you're thinking about, but they're on prescription drugs or over-the-counter medications. And because drugs are so commonly prescribed today, it's hard to find a patient coming in to see you who's over the age of 35 or 40 who's not on a medication. It's your obligation to understand what that medication is doing to the person's body and where there are synergies and conflicts. You should know the effect of each drug is having on the patient's physiology before making any dietary, exercise, or supplementation recommendations. That's only fair. And so having a knowledge of how the drugs work is very important. And you also need to be on the lookout for, and you're going to see these, for adverse drug reactions the person might be having that sometimes will masquerade as the primary complaint. So in up to about 30% of people that go on statin drugs to lower their cholesterol, as an example, the patient experiences muscle pain, particularly back pain. They may not know that's a side effect from the drug. So they go, I've got back pain. Oh, go and see the chiropractor down the street. Go and see the therapist over here. And they walk in and, you're looking around and x-raying and you're manipulating, you're doing orthopedic testing and trying to figure it out when in fact it's actually an adverse drug reaction that someone missed. And when the person goes off the drug, the back pain goes away. So that's a classic example because it's a common one where, for instance, statin drugs can do that. Or the person comes in and they have tinnitus, where they have ringing sounds in their ears as a result of taking too many aspirins, which is not an unusual side effect to the use of acetylsalicylic acid. And you're looking around to see, hearing tests. Is there auditory loss? Is it bone conduction? Is it air conduction loss? And you're doing all the testing, to see where it's coming from. Is it TMJ? Is it some cervical problem? And in fact, it's actually an adverse drug reaction. That's why you have to have some knowledge of this to be a primary healthcare practitioner. So there are about 8 important drug supplement considerations that I want you to factor into your dietary, exercise, and supplementation recommendations. Here they are. Some drugs can do things that supplements cannot do. So in other words, if you're treating patients for a musculoskeletal problem and there's a tremendous amount of muscle contraction and spasm, and you'd say, gee, it'd be great if I could get rid of the spasm, I'd be much more effective. Are there any supplements that act as natural muscle relaxants that really produce a pronounced effect, that really make a difference? And there really aren't any supplements like that. Some people claim certain things can do it. I've never seen any of them work, to be quite honest with you. So there are muscle relaxant drugs like methylcarbamol, like robaxisol, robaxacet, that actually can relax the muscle in a way that no supplement dietary change can do. In certain instances, some supplements can do things that drugs can't do. There are nutrients that can help to regenerate and repair joint cartilage. There are no drugs that can do that. There are no drugs that can actually increase the synthesis of the memory chemical in the brain known as acetylcholine, but some supplements can do that. Some supplements work synergistically with the drug, which will then help to reduce the dosage of the drug required or maybe even eliminate it. So for instance, we know that taking a lot of acetaminophen or Tylenol over a person's lifetime increases their risk of significant liver damage and kidney damage. It's a leading reason why people need kidney dialysis later in life. And liver failure can show up because when acetaminophen gets detoxified, we'll see this, it generates many, many free radicals and intermediates. And if the liver cells run out of glutathione to sort of conjugate that and detoxify it, liver damage proceeds, and the person can one day need a liver transplant as a result of using Tylenol like it's candy. So I'm not saying that some people don't have chronic pain and need to be on painkillers from time to time. But if you can give them things that are less toxic that can reduce the pain and inflammation so their dependency on something that's more toxic is going to be less, you're doing them a huge favor. And sometimes hands-on chiropractic treatment on its own can't do the whole job because it can't affect things on a more biochemical level. Sometimes supplements can work to actually decrease adverse side effects of a drug by reducing the dependency the person has on a drug like that, including some of the morphine-type drugs where there's even greater dependency that the person ends up with. Some supplements can potentiate the effects of a drug, producing serious side effects. So sometimes you recommend a supplement and it actually will amplify the effect of the drug they're taking and actually produces a very serious outcome. Someone who's on anticoagulant drugs, you give them a particular supplement that amplifies the anticoagulant effect. Maybe you didn't mean to do that. And now they start having internal bleeding. They could die. Or you could treat them and a blood vessel could break. The platelets can't clot. You've produced internal bleeding in that person that can be very serious, especially if it happens in the brain or into a vital organ. So it's important that you guard against those types of drug-nutrient interactions. Or you can give somebody supplements that might increase the amount of serotonin in their brain because you feel like it would help them have a better sense of well-being or they're a little bit depressed. But they're already on drugs that raise serotonin levels. Now you've raised the serotonin levels too high. You've amplified the effect, and you produce serotonin syndrome, which can be life-threatening to the person. And this is why you need to be thinking your way through the drug-nutrient interactions at every step along the highway and making sure you're doing things that are positive, not harmful. Some supplements can reduce the efficacy of a drug by stimulating its detoxification. So certain supplements like St. John's wort as an example, which can be used to raise serotonin levels and help to counter depression, also speed up detoxification of the birth control pill. So now a woman thinks the birth control pill is working, but it's being detoxified at a faster rate. She gets pregnant. Now she's really depressed, or she's really elated. But she was probably taking the birth control pill to guard against pregnancy, was she not? And now you just interfered with that, and she became pregnant inadvertently because you speeded up the detoxification of a particular medication. You see the importance of this? And believe me, you'll know it inside out, sideways, up and down by the time I'm done with you. Some supplements are contraindicated based on a health condition. The person has Wilson's disease, known as hepatolenticular degeneration. That means that they can't, for genetic reasons, they don't make enough of the protein that sequesters copper, known as ceruloplasmin, which is made in the liver. So the copper in your body isn't just floating around freely. Because, you know, copper and iron are transition metals. All you need is for a little bit of sunlight to hit your skin. And the photon energy will change their valency, and they'll release electrons, and they'll cause extensive free radical damage. So in your body, ceruloplasmin is the sequestering protein that sort of binds to copper and allows it to travel to the tissues without the risk of it being converted into a very damaging free radical. Some people are born, they don't make ceruloplasmin, they have what's called Wilson's disease, And they die young from the free radical damage. They have to be careful with any food that contains any additional copper. You can't give that person a regular multiple vitamin that has even just 1 or 2 milligrams of copper. You'll accelerate the problem. The same giving iron to somebody who already has hemochromatosis or hemosiderosis, where they can't sequester iron properly. If they're going to take a supplement, it has to be an iron-free supplement. So sometimes a health condition and will change things. Certain supplements require specific monitoring. The person has had an organ transplant, or they're on immunosuppressive drugs, then you have to change. You need to have the specialist approve the things that you may want to do. So we'll talk about that as a special issue. Or the person's already had cancer, or they're undergoing cancer treatment. You want to give them things to actually make the treatment more effective. But in these high-risk situations, you want to get physician approval when you see certain red flags. But you can provide the documentation to show that what you want to do is very useful. When a woman's pregnant or breastfeeding, it changes the whole landscape of your recommendations. Everything changes on that day, as we'll talk about. So those are the primary 8 sort of interrelated considerations as you start thinking about the use of diet and supplements. What are going to be these little posts along the highway to pay attention to make sure you make intelligent decisions? So a little brief history about drugs, because we're going to talk about pharmacology here. And the reason we're going to do it is because people are on medications. And to be a primary healthcare practitioner where patients are taking medications, if you know nothing about them, then you're just completely in the dark, and you can't really enter the arena and make recommendations with any level of confidence or certainty. So we have to visit this. The pharmaceutical industry began in the 1940s. What had happened back in 1928, of course, is that Alexander Fleming, this is only a number of years ago when you think about it. So, we're now at year 2011, 2012. So, 1941 to you might seem like it's a long time ago, but in the history of man, it's, 70 years is not a big time, is not a big window. So, but prior to that, in 1928, by accident, here you have a researcher, working in a lab studying Staphylococcus bacteria in a lab. And just by pure chance, the world changed on this day. Some spores from penicillin, the penicillin mold which was being studied 1 floor below, the spores floated up through the air and happened to land in the Petri dish where Alexander Fleming was studying Staphylococci bacteria. And he noticed that all of a sudden something was killing these bacteria. So he was able to discover that it was actually penicillin. This is just by accident, was able to inhibit the growth and kill certain bacteria. So they thought, I guess we can use penicillin topically. So up until 1941, it was just used on wounds on the surface. No one thought you could swallow it until World War II. During World War II, Chain and Flory showed that taking penicillin internally could actually stop and fight certain types of infections. And when that was discovered, it opened up the window for pharmaceutical companies to start to form and develop and make antibiotic drugs. And because they could put patents on their drugs, it became very alluring to go to investors and say, if you invest in the drug that we're researching, we will have the exclusive rights for that drug. And then if it really works, then no one else will be able to make that drug other than us for a certain period of time before it becomes a generic drug. And we can make lots of money and help lots of people. So with that business model in place, they were able to raise lots of money and sell lots of drugs and keep increasing the number of drugs that they could make. So today, the pharmaceutical industry is a very, very powerful force in our society, as you know. There's now tens of thousands of drugs that exist. But conveniently, for our purposes, most of the drugs are in certain classes. So we're going to look at beta blockers. And there's a whole bunch of beta blockers, but they all basically are acting the same way. What I want you to know is how do the different classes act on the body? You don't have to remember the name of every drug. All I'm asking is that when the patient comes in, if they're on a particular drug, you can search it. You can just do a quick Google search. You go, oh, this drug is a beta blocker. Oh, this drug is a calcium channel blocker. Oh, this drug is a fibric acid derivative. Oh, this drug is a drug that inhibits xanthine oxidase. It's used for gout, as an example. So as long as you know the mechanism of what the different classes do, then for your purposes and my purposes, you can enter into the arena of discussion with the patient. So it wasn't until the 1940s that this whole movement got started. Prior to that, they had noticed that certain extracts from plants could be concentrated to make drug-like materials, and so digitalis was found in the foxglove plant a long time ago, and that dates back to 1785. In a very short period of time, pharmaceutical companies have convinced medical doctors in most of the modern world, unfortunately, to ignore previously used natural remedies and focus only on their synthetic drugs. That's the problem, in my view, is that drugs have become so powerful and used as the predominant treatment method that everything that we've learned about more natural interventions that are useful has been sort of discarded in the traditional healthcare system. The evidence I'm going to show you is that in certain situations, some of those natural things are extremely valuable to be included in the patient's treatment program. But prior to 1941, only natural remedies were available. So for instance, they used colloidal silver to treat tuberculosis and certain infections. I can tell you something right now. If I had tuberculosis, I wouldn't be relying on colloidal silver. You know, antibiotics are a much better choice. So some of the new things that came along are much better than we did traditionally. You know, and it's helped to increase lifespans and giving people better quality of life. But some of the things that exist in the world of modern medicine that are natural, that are being ignored, are tremendously useful, and we should be incorporating them. So the pendulum has been swinging back in recent years. There's now a surge for pharmacologists and microbiologists, but botanists and natural product chemists are really combing the earth for phytochemicals and leads that could be developed for treatment of various conditions. So in other words, we're starting to recognize more and more in the scientific journals that there's many golden nuggets that nature has put into certain plants or certain types of supplements that can make a profound difference in the management of certain conditions, even the prevention of certain conditions, that can do things that even drugs can't do or can be used synergistically with drugs. I think a really great example from my own personal experience in recent years is that I lecture for the American Academy of Anti-Aging Medicine in their division known as Integrative Cancer Therapy. So there's a fellowship program for medical doctors called the Integrative Cancer Therapy Fellowship Program. And they bring me in to teach the medical doctors who are treating cancer in a more integrative way what is the evidence-based adjunctive use of nutrition and supplementation that partners with the types of therapies that they're using. And I can tell you that there's absolutely incredible evidence to show the value of including certain supplements and dietary practices with a patient who's undergoing cancer treatment, with a patient who's already had cancer, been treated successfully to help reduce the recurrence of cancer. There's a huge area, and these doctors are eating it up and utilizing it because they're looking outside the box for integrative things where there's evidence for its basis. But the same thing applies, as you're going to see, for cardiovascular disease, for Parkinson's disease, for Alzheimer's disease, for osteoporosis. Using the best that medicine has in conjunction with the best of evidence-based natural therapies gives the patient the best outcome. So the impact of adverse drug effects, because I don't mean to knock drugs. I'm just saying that drugs are to a large degree overprescribed, and there's almost abuse in the system today. And you start to see it showing up in statistics like you're seeing here, where adverse drug reactions were the 4th leading cause of death in the year 2000. In addition to these causes, the Centers for Medicare in the United States and Medicaid stated in a recent report that the nation spent $140 billion, this is back in the year 2000, just on prescription drugs. Forget about over-the-counter medications that people are using. Just prescription, $140 billion a year. I don't believe all of that is necessary if people understood the proactive things they could be doing some of that could be shaved down considerably. And just about everyone agrees with that.